First of all, I thank you as well as Dr. Bhandari, especially for having given me this chance to meet everyone. Probably it was so interesting to listen to the journey of Dr. Bhandari, which is probably a blatant example of self-discipline in a very scientific manner. And I think if anyone follows his way of lifestyle, probably it is going to be the perfect, it is practically ideal way. Before I start, I must tell you that diabetes is one of the lifestyle diseases. Diabetes is a disease which doesn't affect the longevity and quality of life. You can lead the best quality of life, you can lead the fullest of your life, just you need to be intelligent. I think what the way Dr. Bhandari has given examples, which is praiseworthy, and we need to follow it up. There's a saying, "I sees what mind knows." More and more you update yourself, more and more you know about it, and you should know what you are dealing with. I give you the best example. When you drive, you need to follow the speed line, you need to follow the traffic lights, you need to follow the traffic rules. If you anywhere flout traffic rules, probably are caught and you have to pay the price for that. Same is every disease, we have to understand what are the expectations to keep that disease under control. More so, this is valid for diabetes. So that's the reason before we start talking about the good diabetic control, good health, and good management, we need to know the targets. We need to know what is all about diabetes. So before I start my presentation, I'd like to give you some brief introduction that anyone who is found to be diabetic, anyone who is found to be diabetic, he need to understand whether he's a type 1 or type 2. Normally, the type 1 diabetes, it happening in the age group below 20 to 25, and it is an autoimmune disease because of insulin deficiency, and there's no production of insulin. All the diabetes which comes in third decade onwards, this is because it is a type 2 or maturity onset diabetes, and type 2 diabetes is a stage where there are two components. One is the insulin resistance and another is the insulin deficiency. For my common people, I would just share that insulin resistance is a term which happens most of the time if you are overweight. So type 2 diabetes goes hand in hand with the overweight. Hence, it is mandatory to have the optimal weight and optimal BMI, which I'll be talking to you later in my presentation. At the same time, whenever if someone is diagnosed to have diabetes, if you educate yourself to have the perfect control, and for which the Dr. Bhandari is the best example, you live better than a normal person without diabetes, you live healthier than a person without diabetes. Any disease has its own implications. Diabetes is a disease, if kept blood sugar fasting between 90 to 110 milligram percent, or what we call it to be around 6 to 6.5 millimoles for US standard, and post meal sugar we keep around 140 to 180 milligram percent, which is equivalent to around 8 to 10 millimoles for US standard, and it is assessed by a 3 months parameter known as HB1AC. That is around 6.5 to 7. But as the age advances, one need to understand this is very important. If someone is 70 years, 80 years, or 90 years, there are certain liberties for HB1AC readings are given. If someone has a comorbid conditions, like someone has a cardiac problem, someone has a diabetes, along with diabetes, kidney problem, or someone has any other comorbid condition, we make the liberal values for HB1AC allowable for that patient. So one need to know what are the target values set up by the doctor for his fasting sugar, post-meal sugar, and HB1AC. Next question comes that definitely medical management is integral part of the diabetic management, but equally important is lifestyle management, which includes the regular physical activity, which include diet control, which include the menu which you have been taking, which include the combination of protein, fat, and carbohydrates you should have. So it is an amalgamation of everything which you need to follow it up. Now, if we start with the lifestyle diseases and special management of diabetes, which I'll be talking to later, I'll quickly go through the presentation. When I said positive health means that in spite of having lifestyle diseases, no reason to worry. You can lead the best quality of life and you just follow certain basic principles of life. Can you play the next slide, Puneet, or can I handle? Can I handle or can you play the next slide?
No, you can handle it. It's control. I have given it to you, so you could change it.
Just one sec. I'm finding some issue.
Just put enter and it should work. Yeah.
Yeah. So I'll quickly I'll be concentrating mainly on diabetes, but for just general awareness that these are the lifestyle diseases which could be chronic lung disease or a heart disease. This may arise automatically. Just hang on. Yeah, and important issues which can contribute are the physical inactivity, smoking, and unhealthy diet, which we'll be talking little in detailed perspective later. Next. This is a slide in Hindi which I use, but in fact, our country is known as diabetic capital of the world. India is having second highest number of diabetics next to China. And once we talk about the diabetes, many times, as Dr. Bhandari gave an example of his cousin, that he had a high creatinine, but he did not know any, he did not have any symptom. So one need to be very careful about that diabetes is a disease in which the sugar values go high, and many times you need to know something. Eye sees what mind knows. So you need to be very careful about it, that if you are losing weight for some reason, if you are feeling unexplained tired, if there is an excessive thrust in you have, and if you have excessive urination, you need to be careful about that you may be diabetic, more so if there is a family history, which is very important. Now, another important symptoms which I'll be talking about. Yeah, this is one very beautiful slide. I'm sure most of you know about everything, that there could be always hunger. If someone, every person need not to have any symptom, but there could be excessive hunger, excessive urination, there could be excessive dryness in the mouth, there could be unexplained tiredness and fatigue which can happen. There could be altered vision. Someone may have that his numbers are changing very fast. Any person may come to doctor that every 3 months his numbers are changing. So he need to be very careful about it. All the time he is tired, he feels exhausted. There's a loss of sexual drive and loss of libido. So all these symptoms, if you have, which has not been there in last few months or years, it will be better that you meet a doctor, which is very important. This is one, when I say eye sees what mind knows, you need to be very careful about it, that anyone who is a diabetic or even is not diabetic, he should know about it, that fasting sugar means sugar empty stomach in morning need to be in the range of 80 to 100 milligram percent, or it should be around 5 to 6.5 millimoles, and after meals it should be from 8 to 10 millimoles, that is 140 to 180 milligram, which is very important. So you need to know the values of the sugar which you need to maintain. Once you know about it, then you will be able to maintain your doses and the diet. As I talk to you, there are different type of diabetics. Type 1 is the one where the body doesn't make any insulin, which normally happens with the small children, juveniles, and the young adults below age of 20 or so most of the time. Type 2 is a one where body does not make enough insulin, or there's insulin resistance. It is making insulin, but it is not acting properly. Sometimes, because of stress of the pregnancy, many pregnant women can also have a diabetes. So you need to be very careful to get your sugars tested during pregnancy, known as gestational diabetes. And many times, any of the people are on certain drugs for chronic diseases. Patient may have to take steroids for many chronic diseases, and they could be drug-induced sugar rise. So just for your knowledge, that you need to be very careful about it. Type 2 diabetes is sometimes called a lifestyle disease, as it is more common in people who do not do enough exercise and have an unhealthy diet, and there are overweight or obese. So one of the very important thing is that whenever there is excess calories you have consumed, then your expenditure, this predisposes you to gain weight, this predisposes you to have more fat, and whenever there is extra weight and more fat, it leads to the high BMI. The normal BMI is 18 to 24. When the BMI is more than that, there is an excessive deposition of fat. And whenever there is an excessive deposition of fat in the body, the insulin which is present in body is ineffective. It doesn't act properly, and we call it to be insulin resistant, and patient develops the tendency for diabetes. So it is very important that you need to have optimal weight and you don't let your weight increase. The issue is that whenever, suppose you are a moderate activity performer and your daily requirement is around 2000 calories. I'll tell you later how the calorie bomb, high sugar content food adds the extra calories in your diet. And whenever you consume more calories than what is required by your body, you turn them extra calories into fat. Over the period of time, you gain weight, your body resistance goes down, your immunity goes down, and you become prone for problems like diabetes, the high cholesterol, which all predisposes to cardiac conditions. So I'll just summarize that any normal person in their lifestyle, if they have any of these symptoms, please contact doctor. That is, if you have been going urination frequently, you're feeling hungry all the time, you have a craving for extra liquid, you have a sexual dysfunctions, your libido has gone down, you have an unexplained weight, and family history of diabetes is there, you need to be very careful about it. If you see it on the table of the right side, I written, is there's a mood disturbances or irritability. You find that you are very cool and composed, but there's been some mood disturbances. That's the reason you need to be well aware of many of the symptoms of diabetes in new onset diabetes out of the box. New onset diabetes, there could be a variety of symptoms, and that's the reason you need to pick it up fast. There could be mood disturbances, irritability, blurred vision. You have been asking your optician to change your specs every 3 to 4 months. There could be numbness and tingling of your feet and legs. There's some infection in your body. Suppose you got a throat infection which takes longer than normal. You cut your nail, it takes long time to heal. You got a blade cut on your cheek, which takes long time to heal. So you need to be very careful about that. That's a common man should know about it. This is very interesting. Before I come, all those diabetics, I think we need to follow the example of Dr. Mahendra Bhandari, that he has brought his HbA1c so beautifully down. At the same time, he never ever suffered hypoglycemia. So when we treat a disease, the most important is that we need not to bring down the high sugar down, but we need to prevent hypoglycemia. What is hypoglycemia? Hypoglycemia is a situation when blood sugar level goes below 80 milligram percent, or it goes below 5 millimoles, or 4.5, 4 or 3.5. When the blood sugar goes down, a patient feels shaky, a patient feels unsteady, and sometimes it could be very detrimental. So all my diabetic patients, I would like to remember this slide, that suppose you are a diabetic, you are under treatment of some doctor, make sure there could be some accident that you have taken a pre-meal tablet, and because of some emergency you got delayed in taking your meals, you have taken some extra tablet. So anyone of your family members who's diabetic, we need to be very careful. If someone has an unexplained sudden headache, someone has a ringing in ears, someone start trembling, he is irritable, and there's an excessive sweatiness. So always remember, perspiration or sweatiness is a sign of low sugar. There's a sudden blurred vision. There's an increase in heart rate known as palpitation, sudden hunger and feelings of anxious or weakness or tiredness. It means sugar have gone down. So if I cut short, I would request all the diabetic patients anytime during, suppose you have eaten your meals, but you have gone to mall. Sometime while shopping, you don't realize, and you walk and walk and walk and walk, and the sugar dips down. So anytime you feel sweaty, anytime you have palpitation, and anytime you have anxiousness, please immediately stop. Keep some candies or chocolate in your purse or pocket and eat sweets. Even if you are not very sure what is happening, a high sugar is not that detrimental as a low sugar is. So my message to everyone will be that anytime, if you come across, well, suppose you have taken a cup of coffee and you're going for a jogging, because of some reason your intake of dinner last night was less. So the moment you feel sweaty, anxious and have palpitation, please stop immediately and eat something so that you don't have any cause to worry for the low sugar. And that's the reason the causes of low sugar are too little food, too much of insulin or diabetic medication, or extra exercise. So you need to be very careful about it. It will be always sudden, may progress to very low sugar, and you need to be very careful. So you can eat some candies, you can drink some soft drink, and if possible at handy, you could do your testing also done. You need to be very careful about. This is a very important aspect of diabetic control. Next. Now, sometimes some question can go back. Some question can go, people get confused that how come I know my sugar is low or my sugar is high? The low sugar is known as hypoglycemia and high sugar is known as hyperglycemia. For a common man, I would tell low, L-O-W, since the hypo has a low, so it has a low, and high is a hyperglycemia. So always remember the second point in the hypoglycemia, the sweating and irritability and palpitation. Sweating is one of the most important symptoms when the sugar goes low, and when the sugar is high, many times the patient may have sugar 400, 500, 600. The mouth will be totally dry. There will be dryness of the skin against the sweaty skin of the low sugar. There will be excessive thirst. There will be blurred vision, and there could be headache. So whenever there's an excessive thirst and dryness, it looks like a high sugar. While there's a palpitation and sweaty, it should low sugar. Now, this is the one of the very important slide which Dr. Bhandari was stressing upon. Diabetes is a disease. If you keep the HbA1c the way the Dr. Bhandari has controlled, you follow the wonderful diet which I'm going to talk to you as Dr. Bhandari is doing, probably this slide is not valid for you. This slide is just to educate you that what scares so much about diabetes. It is a simple disease of sugar. No, it is not the simple disease of sugar. If you don't maintain your 3 months average, that is glycosylated hemoglobin, within the optimal levels of 6 to 6.5, or if you don't maintain the fasting sugar around 5 to 6 millimoles, or post-meal sugar around 8 to 10 millimoles, there is always a predisposition. It is just like that you are doing the rash driving, you are doing more than the limited speed, you are driving car with the weak brakes, so that there's a chances of accident. It looks a simple disease, but if we control sugar beautifully, there is no risk to life. But if we don't control, look, it can cause a stroke, it can cause heart attack, it can cause peripheral vascular disease, it can cause many of the eye complications, which includes the retinal damage or intraocular hemorrhage or early cataract or glaucoma. It can cause diabetic foot, a foot ulcer which doesn't heal for a long time. One of the most sensitive complication is the diabetic kidney disease. And the biggest issue is that these complications may be silent for few weeks and months and years before they surface very significantly, and they could be peripheral neuritis. So all these complications makes us feel that we need to have a perfect diabetic control by having optimal medications, optimal diet, optimal physical activity, maintaining the weight, etc. This is again a continuation of the same. As I talk to you, these are the complications. It can affect the oral health with the severe periodontal infections. It can have all these complications, and that's the reason the beauty of diabetic management by diet, exercise, and precautions is that we have to keep away from all these complications. But unfortunately, a reasonable percentage of people, especially in India, because of inadequate control of diabetes, the complication rate of the diabetes is the commonest cause of kidney failure and heart attack in our country. I'm sure if we control the basic disease, we can take care of these complications of diabetes. Lifestyle is the primary approach to the weight loss, which is very important. So first thing that we need to have a proper weight control, which is very important. Now, whenever you are a diabetic, I would suggest that once you are with your doctor, you talk about what is your optimal BMI or optimal weight. If you are above your optimal BMI, which is 18 to 24, then you need to be on a negative calorie balance. When suppose your daily requirement is 2000 calories, ask your doctor to put you on the 1500 or 1400 calories per day. You are minus 500 to 600 calories per day. For your knowledge, that when you are minus 7000 calories, I again repeat, when you are minus 7000 calories, you lose 2 pounds of weight. For losing 1 pound of weight, you need to be minus 3.5 to 4000 calories cumulatively. So one of the most important approach is that in maintaining diabetes, you have to have your optimal weight, optimal BMI, for which you will require a diet and the caloric and nutritionist chart from your doctor, and try to have perfect diet chart. Whenever we talk about diet in diabetes, we need to know that around 60%, what 50 to 60% calories should come from the carbohydrate, not more than that. Around 25 to 30% calories should come from the proteins, and only 10 to 15% calories should come from the fat. If you consume the optimal calories, what is required by your BMI and the type of activity, probably you never put on weight. If you are on the extra calories, then definitely these calories are going to be converted into the fat. So you need to have optimal calorie chart to be made. The division of your diet by the protein, carbohydrate, and fat is to be made, and you need to make sure that you don't overshoot that. When we talk about the fats, there are different kinds of fats available: polyunsaturated, monounsaturated, which and unsaturated fat. You need to use the polyunsaturated fat so that they don't causes the cholesterol deposition. You need to have the adequate amount of salad. You need to have adequate amount of fiber. You need to have adequate amount of fruits. Now, one of the important thing is that whenever we eat food, that's the beauty of the salad and the soup before your meals. Whenever you eat something, it goes in your stomach. The signals from the stomach goes to the brain after 20 to 30 minutes. That's the reason. If you have taken a soup and salad before your major meals, your appetite will be halved. And that's very essential that your major meals need to be preceded by a lot of salad, soup, or any soft drink with practically no calories. So there is a distension of the stomach, signals goes to the brain, and your appetite centers are suppressed and you eat less. So this is very important. You need to take a lot of fiber, which gives the fullness and which takes care of other metabolic issues also, which is very important. I'll quickly go for the next one. So my request to all the diabetics will be regular physical activity is very important. Here I would suggest that 40 to 50 minutes of walk every day. I think Dr. Mahendra Bhandari is a role model for a perfect diabetic and metabolic control. So 40 to 50 minutes of brisk walk is very well recommended for all of you. What does the brisk walk? It could be another like 40 minutes of walk is very essential. You can have gymming, you can have weight training, you can have cardiac, but average you need to do 40 minutes of brisk walking with another 20 minutes 5 days a week. If you can do cardiac or non-cardiac, the weights, physical activity. Here I would suggest yoga also help in the toning of the muscles, in reducing the insulin resistance, and also taking care of your sugar. What does the exercise do? That is very important for you to learn. It controls your weight. It reduces the developing diabetic complications. So exercise reduces the diabetic complications. How? It reduces insulin resistance. You know, just for your knowledge, that who diabetics develop cardiac problem, stroke, and other loss of libido, those who have insulin resistance and high inflammatory markers. There is a term, I'm sure, just remember this. So by physical activity, you reduce the insulin resistance, which is the harbinger, which is the main cause of stroke, cardiac problem, loss of libido, etc. So it reduces the diabetic complication. So look, the physical activity not only reduces the weight, but it takes care of preventing complications. It improves the insulin response. I give an example. If someone is taking 40 units or 30 units of insulin per day without exercising, his sugar level becomes 10 millimoles fasting. But if he starts walking 40 minutes a day or gymming or yoga, doing yoga, with the same 10 units of insulin, his 40 units of insulin, his insulin fasting, which was 10 millimoles, become 8.5 or 9 millimoles. So the physical activity improves the insulin response, which is very, very important. It improves the response of the oral drugs also. It lowers the blood glucose. And one very important thing, good number of patients, I would say 1/3 of diabetic patients over the period of time have high blood pressure and high cholesterol. So physical activity takes care of associated findings of diabetics, which is very important. Now, I would like, irrespective of age and profile, you should exercise daily. How does exercise help you? How does exercise help a diabetic patient? It lowers blood glucose level quickly. It improves the body's ability to use insulin. It reduces the insulin requirement. It controls the diabetes better and reduces the risk of heart disease. So see, what is a great advantage as a diabetic if you have been a regular exercise. You need to exercise 3 to 4 times per week. 60 to 80% of maximal heart rate you need to achieve while you are doing treadmill. Aerobic activity 20 to 30 minutes with 5 to 10 minutes of warm up you should do, which is very important, and it is a very integral part of your disease. Another very interesting thing, if you're a diabetic, make integral part of this. Regular swimming you can do, dancing you can do, cycling you can do, brisk walking you can do. 30 minutes of exercise can reduce the risk of diabetes by 40%. This is a very strong message I would like to give you, the family members of diabetic patients. I would like to give you the friends, someone in their family is a diabetic, that look, because of your preponderance for diabetes, 30 minutes of exercise can reduce the risk of diabetes by 40%, which is very important. Everyone need to have a blood glucose meter. As and when there is some uneasy symptom, it is very important to monitor your sugar, be in touch with telemedication, your doctor, so that you can adjust the doses and diet accordingly. These are the some things which I like to show to my patients, that we have a lot of modalities. We can monitor your sugar levels by putting a sensor like the lady has put for 14 days. And this sensor, you can just touch your mobile phone and have the readings every day, so that we come to know the intraday diabetic variations and managing. Now, what does diabetes do? Look at this. This is a artery of the heart, and an uncontrolled diabetes causes this kind of damage. You can see the blood vessels. My intention of showing this slide to you was just to make you aware that look how important it is to have the perfect HbA1c, so that you don't have this kind of cholesterol deposition and blockade. And our intention is not only to control the sugar, but our intention is only to make sure that we don't suffer complications. What is the relationship between diabetes and alcohol? what is the relationship between diabetes and alcohol, which is very important. Alcohol can cause flushing, nausea, increased heart rate, and slurred speech. So you may get confused with the low sugar. Alcohol stimulates your appetite, which can cause you to overeat and may affect your blood sugar control. And monitor your blood sugar level before, during, and after having a drink. So this is very important. You need to monitor it, very important. Sometimes it is very important all of you to know, because we are social people. We have to lead a normal life. We need to lead like a normal person. Diabetes doesn't debar you to consuming alcohol or doing anything best in life, but it gives you an indication that you need to do everything in limit. You need to maintain your calorific value. Suppose I give you $1,500 to spend. You can buy 5 articles of $300 each. You can buy one article of $1,500, or you can buy 15 articles $100 each. Similarly, if I fix up your daily calorie intake of around 1,500 calories, you can have the breakfast of 400 calories, lunch for 500 calories, another dinner for 500 calories, 100 calories for some supper. But if you consume your 800 calories in lunch, you will have to reduce the dinner calories because you have to maintain the balance. So this is just I wanted you that if you go for partying, if you have a drink, you should know about that how much calories the beer is giving. The red wine is giving you 125 calories. Champagne is giving you 4-ounce champagne, 84 calories. The martini is giving you 124 calories. So, it is just a awareness of yours to how to maintain the calorie contents so that you can plan your day very nicely. These are the one, I think one glass of beer will give you 100 calories, brandy will give you 70 calories, gin will give you 105 calories, just to limit your calorie intake in diabetic patient, which is very important, and that you need to do about it. One of the very important slides I would like my diabetic patients to know that suppose you're a diabetic or you're not been diagnosed to be diabetic, but you find this kind of haziness in your vision. You see on the left, this is how a straight scene looks with a normal vision, and the same scene with the diabetic retinopathy. So the moment you find the haziness, or you never been tested for diabetes and you find the visual haziness, please immediately report to doctor. As I said to you, eye sees what mind knows. So any alteration in the vision, any haziness in the vision, you need to be very careful to report to doctor, and that is very essential for diabetic. So if I tell you that every diabetic patient need to have a good sugar control, maintaining sugar values within normal limit, fasting and post meal, maintaining HbA1c, that is glycosylated hemoglobin 6.5 to 7. If you have a diabetic kidney disease or heart problem, and if you are 70, 80 plus, your HbA1c may be relaxed to 8 also, no issues at all. You need to have defined caloric chart by your doctor to maintain your BMI between 18 to 24, preferably 22 to 23. You need to have a perfect diet chart with 50 to 60% calories from carbohydrate, another 20 to 25% calorie from proteins, and only 10 to 15% from fat. But your diet should be full of high fiber, high carbo, high fiber, and high roughage, lot of vegetables and fruits. You need to be aware of calorie contents of whatever you eat. I give an example that one good size apple will give you around 60 to 70 calories. It is full of fiber. And one vanilla ice cream of medium size will give you 250 calories. Now, vanilla ice cream is full of carbohydrate, has a high glycemic index, which gives you 250 calories, while one apple of medium size will give you 80 calories. Now, if you eat 3 apples, which is equivalent to one medium-sized vanilla ice cream with high glycemic index with 250 calories, and it doesn't fill up your belly because it's low volume. Now, apple with lot of fiber, very low glycemic index, and the volume of 3 apples fills up your belly, which gives you satiety. So you need to have low calorific diet, high fiber diet, high volume diet, so it gives you fullness. It has a low glycemic index. So there are a lot of fruits like all the bakery products, all the cheese, all the dairy products, the pastry, the cake, all the sweets, they are high glycemic index food which should be avoided. All the fiber containing low glycemic index food should be preferred. So for a common man, any common man, here is a very interesting slide I would like you to see. When to meet a doctor if you have. So this is for especially for who have not been diagnosed, who has a family history of diabetes, who has some near cousins or the family member who's diabetic. I think this is a very important, everyone need to know when to meet a doctor if you have excessive thirst, hunger and urination, if there's a family history of diabetes, if there's an excessive tiredness and fatigue, if there's a frequent changes of glasses, if there's a weight loss unexplained, you are not making an effort, if you have a long-term recurrent skin infections and you have recurrent urine infections, please meet your doctor if you have not been diagnosed to be diabetic, or if you are a diabetic and you are developing these things, it means you have been inadequately controlled. You need to be properly controlled. There are different modes of treatment. You can give, initially you can control by diet and exercise. Then if type 2 diabetes, you can have orals. Then the biggest questions which our patients pose to us, why I've been put on insulin? Can we avoid insulin? Why, how long insulin will last? What is the advantage of insulin? I think I could answer all those multiple issues which commonly a diabetic patient raises to us if any questions are posed to me. So that I'll wait for that. Now, one of the concomitant problems with diabetes is a hypertension, and one should always remember a diabetic is prone to have high blood pressure. Today, my intention was diabetes is not an alone disease. We need to educate people about the comorbid conditions. And as I told you, you should be well aware of that what you need to look for in life. All diabetics are supposed to control blood pressure better than non-diabetics. They should know what are the normal limits of blood pressure, what are the healthy limits of blood pressure, and what are the risk factors. If you see, I made a traffic light signal here, which shows the red light when the upper blood pressure, which is known as systolic, is above 140 and diastolic above 90. We call it to be danger zone, more so for diabetics. The yellow zone in which we need to be careful, the upper blood pressure is 130 to 139 and lower diastolic blood pressure is 85 to 89. And once we are in a green zone, which is a must for all diabetic patients, that upper blood pressure need to be 120 and lower blood pressure need to be 80. So my suggestion to all diabetic patients is that all of you had to be in the green zone to protect your kidneys, protect your eye, and protect yourself from stroke. If you are in a yellow zone, please be careful and watchful and talk to your doctor. And red zone, I think try to avoid red zone, which is very important, is there. Now I'll tell you something about blood pressure in all the diabetic patients because you need to be very careful about it. There are many conditions in diabetic patients which can predispose to blood pressure. Inactivity is one. So always remember, as a diabetic, you need to be very active, otherwise inactive will predispose to blood pressure. Stress can cause blood pressure. We have a joke in medicine that stress and anxiety can cause every possible disease except pregnancy. The obesity, alcohol, high sodium diet, tobacco use, as the age advances, there could be blood pressure, and menopausal medication can also raise the blood pressure. So all of you need to be very careful in diabetic patients. You need to be very careful about it. These are the comorbid conditions in diabetic patient you can have. You need to just take a note of it, that there are many other conditions in diabetic which can cause like that. Go back, yeah. Again, if you look at the living with diabetes and high blood pressure, here the diet and exercise is very important. And why it is important, if you see the lowest point, it can cause damage to the kidneys and it can cause a lot of issues, high blood pressure in the pregnant woman if they coincidentally had the gestational diabetes. Now, it is very important, all diabetics should have a blood pressure instrument at home. I would recommend strongly that along with the blood sugar monitoring, once a while, all diabetic patients should maintain the blood pressure record at home, which is very important, and it is very important. Now, this is a very interesting slide, my favorite slide, that if a diabetic patient has a high blood pressure also, there is a diet known as DASH diet. This is dietary approach to stop the hypertension. A diet rich in fruits, vegetables, low-fat dairy food can substantially reduce the blood pressure. So you need to. Now here the caveat is, there are certain fruits which are not a fruit of choice written here for diabetics. Like one banana gives you 200 calories. These are the fruits which gives you a lot of potassium. So if you are associated hypertensive and diabetic, you can use these fruits like banana, garlic, poultry product, potato, beetroot, onion, olive oil, nuts, omega-3 rich food, and avoid. But make sure certain fruits like banana gives you 200 calories, a mango gives you 280 calories, one like you need to have low calorie, high fiber food like papaya. You need to have, so you need to be careful. But any diet low in dairy fat and rich in potassium is good for hypertensive diabetic, and you need to be careful about it. Next, we can go for. So again, any diabetic patient, if he has any of these symptoms, he should meet a doctor. Most of the time, what happens, a diabetic patient develops the silent kidney disease. And silent kidney disease sometimes may present with the following symptoms. Patient may have unexplained headache, patient may have vertigo and giddiness, there could be imbalancing while walking, there could be visual disturbances, breathlessness, nausea and vomiting. So all need to be very careful about it in a diabetic patient, because that can cause high blood pressure, which is very important. So this is another thing. And now that comes the crux back. That comes the breath, that all diabetic patient has to have the optimal weight. Can we have the first slide? Yeah, this one. This is the one we need to be very careful about. You need to be very careful about that. You have to restrict your intake. You have to restrict your carbohydrate. You have to restrict your calorie bombs. You have to reduce your weight to keep the optimal sugar control as well as blood pressure control. You have to shed off your obesity. Initially, 20 to 30% patients can really very well respond to adequate physical activity, maintaining the adequate BMI and adequate diet control, and the ideal role model which was shown by Dr. Bhandari. This is all forbidden for a diabetic patient, and I think we need to avoid it. Next, can we go for? Next, we can go for. An increase in intake of energy, dense food that are the high in fat are responsible. The fundamental cause of obesity and overweight is an energy imbalance between calorie consumed and calorie expended. Globally, there has been an increase in physical inactivity due to increasing sedentary nature of many forms of work, changing modes of transportation, increasing urbanization. So we need to have tilt more towards expenditure than intake, which is very important. The cardiovascular diseases, especially the heart disease and stroke, which are the leading cause, and diabetes is the another one, which is the leading cause. So it is very important that we need to take care of obesity. If a diabetic patient, here I have mentioned the medications in pediatric surgery. If a diabetic patient who is extremely obese, he has not been able to achieve his optimal weight by lifestyle diseases, adequate medications, and adequate control, with the help of doctors, he can think of pediatric surgery, which is very important. Now, once I talk about treatment, I would like to share with you that all in type 2 elderly diabetes, initially patients respond very well with the oral drugs. What does oral drug do? Oral drugs increases the insulin secretion, and oral drugs reduces the sugar. But you must have seen a good number of patients after 5 to 10 years of diabetes, they fail to respond to oral drugs. Sometimes we can give a combination of 2 drugs, 3 drugs, 4 drugs, But in spite of that combination, many people continue to lose weight and continue to have high blood sugar. So my message to all diabetic patients will be that if you are taking a combination of 2 to 3 drugs, and if your blood sugar fasting is about 8 to 10 millimoles fasting, about 10 to 12 millimoles PP in spite of 3 to 4 drugs, it means your body is deficient in producing insulin. And all type 2 diabetic, over the period of time, they start behaving like a type 1 diabetic. What is that? The body's inability to produce insulin. So you require insulin supplementation. So my suggestion will be that whenever we treat diabetes, the primary aim is to achieve target of perfect fasting and PP control, for perfect BMI control, perfect glycosylated hemoglobin, irrespective whether you are given by your doctor oral drug or injectable drugs. Only thing is that you have to achieve target, reduce your carbohydrate and calorie bomb food, have the optimal calories, optimal proteins, and minimal fat as recommended. Have food full of high fiber diet, and you have to have breakfast as a gold, the lunch as a silver, and dinner as a bronze, the lightest one. And if everything goes well, most of the patients will respond to this treatment. But many times, the significantly obese patient may seek opinion of doctor for any pediatric intervention, which is very important. Can we go for, just close the slides and go for the last one? Can we go for the discussion now? Yeah, this slide, I'll just back go for it. Yeah, that's a fine. So this is the energy balance we need to have. The energy expenditure has to be more and energy intake has to be less. You can see there's more of a salad, more of a high fiber diet, more of a food. So this should be the protocol every diabetic patient need to follow, and that's very important. We need to obey it. Fine. Now we can go for our discussion, sir.
Thank you very much, Dr. Bhandari, for a very lucid and clear exposition.